Hello, my name is Dr. Luther, and I am the chiropractor at Glacier Chiropractic in Ballard, Washington. And I just want to talk to you about 7 signs that you might actually need to see a chiropractor. So before I actually get into that, first let me just tell you about a few things that you can do on your own before going to a chiropractor. The first thing you can do is to use some ice. You can use some ice on your neck. You don't want to put the ice right on your skin. You want to have a layer between the ice and your skin, like a paper towel or a kitchen rag, and get your neck nice and cold. And just really kind of, the reason that ice works really well is because it acts as a pain reliever. It relieves pain because it numbs the area, and it also constricts the tissue so that it pushes the inflammation away from the area. So that's one of the first things you can start with is using ice. You want to use ice for 20 minutes. And you can do that once per hour. So every hour you could ice your neck for 20 minutes. And that's a really effective way of relieving neck pain. Second thing you can do is to check your pillow to make sure that your pillow is good. First of all, you should be sleeping on your back or your side, sleeping on your back preferably. If you're sleeping on your stomach, that's going to hurt your neck over time. But you want to sleep on your back, and your pillow should be really supportive, and it should just really get right up under your neck so that it supports the curve in your neck really nicely. You don't want to have too many pillows. You don't want to have your head pushed too far forward. It should be 1 or 2 pillows and just super supportive. Me, I like to have kind of like a Tempur-Pedic pillow below, and then I use like a down pillow, and it sort of really cups and holds my neck in a great position. And that way you're not sleeping with your head turned all night long. So that works really well. Another thing you can do is just to try some light neck exercises. So you can start off by doing some really gentle stretches. What I like to do is to just kind of pull like this, just really gently, and to hold it for about a minute on each side. So you can kind of go down and forward about 45 degrees. You hold that for about a minute on each side. And you can do that several times a day. So that's going to stretch out the muscles back there that get really tight that can cause some of the neck pain. Another thing you can do are kind of chin retraction exercises. This is something that a lot of physical therapists teach their patients is to like tuck their chin. So you can do little chin tuck exercises here. And when you're doing that, you want to really be firing the muscles in the back of your neck a lot. And those stabilization exercises can be very helpful. Something that you want to avoid if you're unable to even turn your neck is just make sure that you avoid driving. That's one of the main things, because that can be